there were three things that happened. I was the first one to write a paper on flying if you've had a stapedectomy. Up until the time that I wrote this paper, if you were a pilot and you had had a stapedectomy, you were grounded. So that meant there were many American airline pilots or Delta or Air Force pilots, etc., who were grounded because they had a stapedectomy. And of course, they either had to have a stapedectomy or quit flying anyhow because they had such hearing losses. While working in Israel, the chief flight surgeon brought me a man by the name of Menachem Shmuel, who was in his early 40s at the time and who was losing his hearing rapidly. He had otosclerosis. And as the chief test pilot, he was invaluable. And I thought a lot about it, and I felt that the reason that the previous patients or flyers that had the problem was the method that they were using to do the stapedectomy. And in my own mind, I developed a method that I thought would not be a hindrance to their flying. What had happened to the other pilots, if they were flying combat, or if they had an explosive decompression and it went down fast, and the pressure increased in the ear, it drove the prosthesis into the inner ear. The pilot had terrible vertigo, could make no sense of where he was, and they crashed. By using the proper prosthesis and the proper tissue graft over the window I created, I felt that couldn't happen. So I operated on Menachem Shmuel, kept him off of flying for 3 months, and put him through a decompression chamber. Took him from 10,000 feet to ground level in about a minute. No problems. After that, I operated 7 more pilots, combat pilots. And the Israelis fly in practice as though they were in combat, as though they were in combat. It's all on computer, how they performed and so forth. So it's not just flying around up there. Once I published that paper, the airlines then changed their thinking on it. The Air Force did, the Army Air Force did. So it made a huge difference in the world of pilots that you can have a stapedectomy if it's done a certain way and go back to flying. And of course, for Israel pilots, where they're so valuable with so much training, it was just wonderful. Menachem Shmuel is maybe the hero of my life. Menachem Shmuel was the chief test pilot for the Air Force, the chief test pilot for IAI, which is the Israel Aircraft Industries, the largest exporter in Israel. And among test pilots in the world, he may be the best known and the most respected. At the 100th anniversary of the first flight by the Wright brothers, he was chosen to give the inaugural address. And the inaugural address, because the guy is extremely bright, was Flight 100 years from now. So that was number one. Number two, we had always been taught that if you were pregnant and had otosclerosis, not to get into that position. In fact, we were taught if a woman was otosclerotic, we advised them not to have any babies. And because their hearing got worse during the pregnancy. And up until 1950, the House Group in California, which was Los Angeles, which was one of the leading facilities in ear in the world, up until 1950, offered abortion as an alternative to having a baby if you were otosclerotic. Well, while working in Israel, and I don't know why it took me so long, I noticed that the women who had the ultra-religious Jews who had 6, 7, or 12 children didn't have any worse hearing than my population in the United States. And what we did then was to match women 20, 30, 40, 50, or 20, 30, 40, who with one child, 2 children, or no children, or 10 or 12, and match them by the number of children and their ages. And sure enough, we found out that the women who had many children had no worse hearing than the women who had no children. Well, that was unbelievable. So I went back through the literature, and it turned out that every paper in the literature was written retrospectively. They would ask the woman, when did you lose your hearing? I lost it right after my second baby, right when I was pregnant with my first baby. Well, women relate their life cycle by their children. When they had their first baby, when they had their second baby. If I ask Brian, when such and such happened, he said, well, you know, the time that I hurt my ankle, or the time that I had this injury, or when I was working so-and-so. So men relate things by where they are in their schooling, or their injuries, or their sports, or so forth. Women by their pregnancies. So this really made the figures in the studies irrelevant. So I called my chief, Bill Saunders. I said, Bill, you taught us, and we were all taught at that time and during our residency, the same thing, that if you're pregnant and you have otosclerosis, the hearing is going to get worse. So we all advised our women all these years not to have children. Well, I said, where'd the information come from? He said, Bill, I don't know where the original paper was, but you're right, it's a fact. But get a hold of Wes Bradley. Wes Bradley remembers everything he's ever read. So I called Wes. He was 92. He was out playing tennis. His wife said, he'll call you when he comes home. So came home and I told him the story. I said, Wes, where was the original paper? And he said, Bill, I remember the original paper, but it wasn't even written in English. He said, give me a day or so and I'll FedEx it to you. So sure enough, 3 days later, the paper arrived. It was a paper written in Germany, and I believe it was 1938. Now, otosclerosis is a hereditary disease. It tends to run in families. And of course, the Germans did not want any hereditary diseases. They wanted a very pure Aryan population without hereditary diseases. And it gave it described the whole meeting. There were 9 physicians there. There were only 2 that believed that pregnancy made the hearing worse, but there was a man there, a supervisor from the Nazi Party, and he made a eugenic decision, not a medical decision, but he didn't want any congenital diseases, hereditary diseases in the population. So there were 79 women in the study. They aborted 77. And that was the ridiculous paper that led us all to believe all over these years that hearing was made worse, otosclerosis, the hearing in otosclerosis was made worse by pregnancy. At that time, when we wrote the paper, there were 6,000 references in Google that said, don't get pregnant if you have otosclerosis. So we were able to, we wrote the paper on it, and to absolutely reverse that. And it becomes especially important if I tell you that otosclerosis is a disease of the Caucasian race. So it is not found in many, many parts of the world. Now, the birth rate is lowest in the Caucasian population. So we were telling the population that should have had the most babies not to have babies. The last thing that was a major contribution was what I named the long prosthesis syndrome. I had a dentist called me from Toledo. He had been operated by an excellent physician in Michigan and had lost all the hearing, but this was about a year later. He was unsteady. He had lost his power of concentration, but the big thing was he had a tremendous memory loss. Could not remember his phone number, at times not his children's names. He couldn't remember, he tried going back to work, couldn't remember with what patient he was working or what he was doing. So when he went into a room, the nurse would write a little yellow piece of paper, third molar on the, or second molar on the right needs this or that. So he would put it in his pocket somewhere, and if something happened to interrupt him while he was working, then he would look at the paper to see what he was doing. And his wife said that if he would fall asleep on the couch and would get up, he wouldn't know where he was or how to get to the bathroom or the kitchen or the living room. It was just an awful life he was leading. So I had seen this before, about 5 times in my career. And the symptoms were very much the same as his. And I had written about it, but only in a little paragraph where I was writing about, complications of stapedectomy and so forth. So what I did with him, I felt it was, well, let me get back. I operated him the next day, and the following morning, the day after he was operated, my receptionist called me at 9 o'clock and said, "Dr. Levin is here, he wants to see you." And I said, "Oh my God, the guy could hardly walk yesterday, and here he's out of bed and feeling good already." He walked in laughing, his wife was crying, and he said, "Look at this, Dr. Lippy." Now his hobby was yoga. So he stood on one foot and pirouetted around, and he said, "This is what they call the tree." He said, "I could do this until my leg got so tired I couldn't stand anymore." I got my memory back, I got my balance back, I got my concentration back. I can't believe it. You saw me yesterday. A month later, I got a call from a doctor in South Dakota. He had operated on a woman who was within 2 courses of getting her PhD in music. Same symptoms: unsteady, no concentration, memory loss. When she and her husband sat in front of me, I took the history, her husband said, "You know how bad her memory is, Dr. Lippy?" She asked me in the waiting room, "Now what's 12 times 12? He said, "It's awful. She can't remember it. She can't remember who the student was sitting next to her or what they were playing." And this has been going on for 2.5 years. I operated her the next morning. They called me I called the motel at 9 o'clock, and they had left. I said, "Well, that's a good sign." They called me at 11 o'clock or 11:30. They had just crossed from Indiana into Illinois, and they were both laughing and crying at the same time. Her husband happened to be a pilot for Delta, but they couldn't fly here because she couldn't get on an airplane. And so they were driving home. And she said to me, "Dr. Lippy, I'm not riding in the car, I'm driving. I can remember everything. I'm not dizzy, I'm not unsteady, my memory is entirely returned. I can't believe it." And they were both crying. So with this one, I immediately wrote, I didn't want to go through a 2.5-year peer review, figuring if I've seen 7 of these now. They're all over the place, but the doctors aren't recognizing them because they were both operated by good doctors. And in both cases, the prosthesis that he put in was not too long. It was just too long for that patient, and I made that point. So I called the editor of our main journal, John Naparco from Hopkins, told him about it. He said, "My God, Bill," he said, "let's get that in right away." He said, "Send it to me. We're not going to put it through peer review. Everybody knows you're honest and your work is great. and I'm going to put it in a letter. Let's put it in a letter to the editor. It'll be published immediately. So they did. Then about 4 years ago, maybe the greatest thing in my career happened to me, and that was when the editor of one of the prestigious ENT journals called me and said, "Bill, you have done more stapedectomies now than any active surgeon in the world. You've written more, but your writings are all over the place. And we will agree that if you will review your career in papers, that we will not subject them to peer review, because peer review is a real pain. It takes about 2.5 years from the time you decide to write a paper to get permission to write it, so what they call an IBR or an IRB. Then you've got to review all the literature. Then you've got to review all your own stuff. Then you've got to write it. Then you've got to rewrite it and rewrite it. Then you send it for peer review. They make corrections, or they want to change this or change that. You have to do that for them. And then by the time you finish it and rewrite it, it's about 2.5 years till it gets published. So this was tempting, but I said, it would just be too much work at this point in my career to do all that, but let me think about it. So I talked to my son, David. David said, Dad, people learn much more these days by listening and watching than they do by reading. Why don't you do a series of videos? So I said, David, that would be like giving a series of 30 or 40 or 50 lectures. That would drive me nuts. It would drive the audience nuts. So I thought about it, and I thought, gosh, my partner Lenny Barinholtz is as knowledgeable as I am. He had a fellowship here. He was a marvelous surgeon before he even got here. He's done a lot of stapedectomies. We've done them together. I've assisted him in doing some. He's an excellent surgeon. He knows all about it. So we decided to have a series of conversations. And then David arranged that, and we did a number of videos, and it has been highly successful. Our videos are used in all the residencies. They're used all over the world for people in practice, because they give a number. What do you do if you have this problem, this, that? And they can go right to the physician's library, and they can review a video on that. They're used in the residencies. The residencies have journal club, where every Monday or morning, you meet at 6 o'clock in the morning. Everybody has read the same journal article. One presents it, the rest discuss it, and that's the way they do it. Now, instead of reading, they're looking at these videos. So they'll take 3 or 4 videos, they'll all go through them. Now they come, one presents it, but they have the video there, they can go back and look at it. No, he said this and not that. And I remember once, about a year ago, at the University Hospital in Cleveland, they invited Lenny and myself to come to one of their journal clubs, which they held, fortunately, in the evenings now. And the chief resident presented it, and everybody had read it, and then they had a discussion on it, and they asked Lenny and me certain questions. The chief resident then said, Dr. Lippy, I've been coming to Journal Club for 5 years, and I've talked to a lot of my peers here. All of us agree that this method of a journal club is the best we've ever had. And she said, I've been doing this for 5 years. Your work is marvelous. So once a year, the Academy of Otology gives an award to the physician who has contributed most to the field. Up until, and all these years, you really couldn't get this award. You weren't really eligible unless you were a full-time full-time academic physician. And of course, I'm not. I have a private practice, but I do lots of teaching. So it was an award that I could never achieve. So about 3 years ago, maybe 4 years ago, at the meeting, you have an academic meeting, then one night there's a formal dinner, a tuxedo dinner, and there's, at the end of the dinner, the immediate past president goes up in front of the room, and they have a huge screen, and they are going to present the award, one person a year. It's like getting into the Hall of Fame in football if they only take one a year. So it's impossible for me. So the first picture they showed, sort of blurry, you can't tell what it is. The second one is a child, kind of make the child out. The third one kind of looked like me. I couldn't believe it. By the fourth one, I was sure. So it was a fantastic award that I never thought I could ever earn. And at that time, I was 80 years old. I mean, it's very, very unusual. And they had invited all the children, and I knew nothing about it. Sandra knew about it. The kids knew about it because they were invited. And for once in my life, I had to respond to this. I was absolutely speechless. I mean, to receive this from your peers. And how is the award developed? There are 10 people on the committee, all of whom are the university professors. They all present a list of, let's say, 10, I think it's 10 people. Then now there are 100 people. Then they all vote on those. To have my peers, all of whom were in academic medicine, elect me was probably certainly the high point of my academic career. And I really owe that to David, because if it hadn't have been for that marvelous video presentation that he arranged, it never would have happened.